Hello everyone. This is the ABG series scenario 4 brought to you by the Medicine Project. Let's have a look at this interesting case. So, a 23-year-old male was brought to the emergency by his friends after he suddenly started vomiting and hyperventilating while having a party. 2 hours back, the patient was boasting to his friends about inventing a mint beer to prevent bad breath from alcohol and had chugged down an entire bottle. On examination, the patient appeared toxic, disoriented, and tachypnic. Patient's breath had a minty odor to it. Pulse was 125, BP was 110 by 68, and a bedside ABG revealed the following findings. Let's have a look at that. So pH was 7.43, PaCO2 was 23, bicarbonate was 15, lactate was 1.2, sodium 134, and chloride was 100. The pH appears to be strangely normal here. So, what do you think is the ABG disorder? What caused this problem, and how can this patient be managed? And would you consider intubation to be absolutely necessary? Okay, so this is a case of high anion gap metabolic acidosis and respiratory alkalosis. If the history is observed properly, the mint beer probably was made by mixing wintergreen oil in the conventional beer. Wintergreen oil is distinctly sweet and has a minty odor to it. It also contains concentrated amounts of methyl salicylate. So this is possibly a case of salicylate poisoning. Based on the Winter's formula, as is mentioned here, the PaCO2 should have been around 28 to 32, which is not the case. So there has to be an additional acidic component for which it is compensating. For the management of this patient, supportive care, oxygen therapy, and maintaining hyperventilation is necessary. Glucose infusion to prevent neuroglycopenia, administration of activated charcoal, sodium bicarbonate bolus, and infusion at the doses mentioned or depending on each case can be done, and check salicylate levels and ABG every 2 to 4 hourly. Also, do not try your own inventions on yourself, involve your friends in it for suggestions, of course. So avoid intubation in this case unless absolutely necessary because mechanical ventilation can offset the respiratory drive. Hyperventilation is a protective mechanism, so we are supposed to use it. And mechanical ventilation can worsen the acidotic component. Alkaline pH is to be maintained to keep salicylate in an ionized form and prevent cellular entry. Please like and follow. Thank you.